Hi and welcome viewers of Nursing Academy 101. I'd be happy to provide you with some challenging NCLEX-RN and Prometric style questions related to the nervous system, along with the answers and rationales. Please note that these questions are meant to be difficult and may require a comprehensive understanding of the topic. But before we start, please do not forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question 1. A 45-year-old patient is admitted to the emergency department with sudden onset severe headache, nausea, and photophobia. The patient's blood pressure is 180/110 mmHg, and a lumbar puncture confirms the presence of subarachnoid hemorrhage. Which nursing intervention is the highest priority for this patient? A. Administer intravenous pain medication. B. Initiate strict bed rest. C. Maintain strict blood pressure control. D. Administer antiemetic medication. Answer. C. Maintain strict blood pressure control. Rationale. Subarachnoid hemorrhage is a medical emergency often caused by a ruptured cerebral aneurysm. Maintaining strict blood pressure control is a critical intervention to prevent further bleeding and complications. Elevated blood pressure can worsen the hemorrhage and increase the risk of rebleeding. The other options are important but not as high a priority as controlling blood pressure to minimize the risk of worsening the hemorrhage. Question 2. A patient with amyotrophic lateral sclerosis, ALS, is experiencing difficulty swallowing and has recurrent episodes of choking. Which intervention should the nurse prioritize to address the patient's swallowing difficulties? A. Provide a soft diet. B. Elevate the head of the bed during meals. C. Administer anticholinergic medications. D. Initiate enteral tube feeding. Answer. D. Initiate enteral tube feeding. Rationale. ALS is a progressive neurodegenerative disorder that affects motor neurons, including those responsible for swallowing. As swallowing becomes increasingly difficult and unsafe, initiating enteral tube feeding is a priority to ensure the patient's nutritional needs are met while preventing aspiration and further complications. Question 3. A 60-year-old patient is admitted with a diagnosis of myasthenia gravis. Which nursing action is essential when caring for this patient? A. Administer muscle strengthening exercises. B. Encourage a high-protein diet. C. Administer medications on a fixed schedule. D. Monitor for signs of peripheral neuropathy. Answer. C. Administer medications on a fixed schedule. Rationale. Myasthenia gravis is an autoimmune disorder characterized by muscle weakness and fatigue. The administration of medications, such as acetylcholinesterase inhibitors, is crucial to improve muscle strength and function. These medications need to be administered on a fixed schedule to maintain consistent therapeutic levels and manage the symptoms effectively. The other options are not as relevant for managing myasthenia gravis. Question 4. A patient is diagnosed with Guillain-Barré syndrome and is experiencing ascending muscle weakness. Which assessment finding requires immediate nursing intervention? A. Decreased heart rate. B. Hypoactive bowel sounds. C. Urinary retention. D. Hypertension. Answer. A. Decreased heart rate. Rationale. Guillain-Barré syndrome can lead to autonomic dysfunction, including cardiac arrhythmias. A decreased heart rate can indicate parasympathetic involvement and may require immediate intervention to prevent further complications. The other options are common manifestations of autonomic dysfunction in Guillain-Barré syndrome but are not as critical as addressing potential cardiac issues. Question 5. A 30-year-old patient is admitted with a suspected brainstem lesion. Which assessment finding indicates dysfunction of the cranial nerves located in the brainstem? A. Dilated pupils. B. Weak hand grip. C. Diminished pedal pulses. D. Decreased bowel sounds. Answer. A. Dilated pupils. Rationale. Dysfunction of the cranial nerves located in the brainstem, such as cranial nerve 3, oculomotor nerve, can lead to pupillary changes, including dilation of the pupils. This finding suggests impairment of the autonomic control of pupil size and is indicative of brainstem involvement. The other options are not specifically related to dysfunction of the cranial nerves in the brainstem. Question 6. A 72-year-old patient with a history of Alzheimer's disease is admitted to the hospital with a fever, altered mental status, and nuchal rigidity. The patient's family reports that the patient has been more forgetful lately and has had difficulty performing daily tasks. The nurse suspects viral encephalitis. Which action should the nurse prioritize? A. Administer antibiotics. B. Administer antipsychotic medications. C. Administer antiviral medications. D. Initiate physical therapy. Answer. C. Administer antiviral medications. Rationale. The patient's symptoms, including altered mental status, fever, and nuchal rigidity, are indicative of viral encephalitis. Antiviral medications are the primary treatment for viral encephalitis and should be initiated promptly to reduce viral replication and improve outcomes. Administering antibiotics would not be effective against a viral infection, and antipsychotic medications and physical therapy are not the primary interventions for this condition. Question 7. A 28-year-old patient with multiple sclerosis, MS, presents with sudden worsening of symptoms, including blurred vision, muscle weakness, and difficulty walking. The nurse suspects a relapse of MS. Which nursing intervention is a priority for this patient? A. Administer corticosteroids as prescribed. B. Provide emotional support and counseling. C. Encourage the patient to perform strenuous exercise. D. Initiate intravenous immunoglobulin therapy. Answer. A. Administer corticosteroids as prescribed. Rationale. A relapse, exacerbation, of multiple sclerosis is characterized by a sudden worsening of neurological symptoms. Corticosteroids, such as methylprednisolone, are commonly used to reduce inflammation and shorten the duration of the relapse. Providing emotional support is important, but administering corticosteroids to manage the acute exacerbation takes priority. Strenuous exercise and intravenous immunoglobulin therapy are not typically indicated for managing a relapse of MS. Question 8. A patient is scheduled for a lumbar puncture to assess cerebrospinal fluid, CSF. Which position should the nurse place the patient in for the procedure? A. Supine with a small pillow under the head. B. Prone with the head turned to the side. C. Side lying with knees bent and head flexed. D. Sitting upright and leaning forward. Answer. D. Sitting upright and leaning forward. Rationale. The patient should be positioned in a sitting upright and leaning forward position for a lumbar puncture. This position maximizes the space between the vertebrae, facilitating access to the subarachnoid space for CSF collection. The other positions do not provide optimal access for the procedure. Question 9. A patient with a spinal cord injury at the C4 level is receiving mechanical ventilation. The nurse notes decreased breath sounds on the left side and tracheal deviation to the right. What should the nurse do first? A. Administer a bronchodilator. B. Suction the endotracheal tube. C. Increase the ventilator rate. D. Notify the healthcare provider. Answer. D. Notify the healthcare provider. Rationale. Decreased breath sounds on one side and tracheal deviation may indicate a pneumothorax, a potentially life-threatening complication. Prompt action is needed to address this condition. Notifying the healthcare provider is the first priority to initiate appropriate interventions, which may include chest tube insertion. The other options are not appropriate as the initial action for suspected pneumothorax. Question 10. A 50-year-old patient is diagnosed with trigeminal neuralgia, tic douloureux. The patient experiences severe, stabbing facial pain that is triggered by touch or chewing. Which nursing intervention is appropriate for managing the patient's pain? A. Apply cold compresses to the affected area. B. Encourage the patient to perform facial exercises. C. Administer opioids as prescribed. D. Provide warm saline mouth rinses. Answer. C. Administer opioids as prescribed. Rationale. Trigeminal neuralgia is a condition characterized by severe, sudden-onset facial pain. Opioids may be necessary to manage the intense pain associated with this condition. Applying cold compresses, facial exercises, and warm saline rinses are not effective interventions for trigeminal neuralgia and may even exacerbate the pain. Question 11. A 58-year-old patient is admitted with a suspected cerebellar lesion. Which assessment finding is consistent with dysfunction of the cerebellum? A. Visual hallucinations. B. Muscle weakness. C. Intention tremors. D. Difficulty speaking. Answer. C. Intention tremors. Rationale. Intention tremors, which occur during voluntary movement, are a classic sign of cerebellar dysfunction. The cerebellum is responsible for coordinating smooth and accurate muscle movements, and its impairment can lead to tremors during purposeful actions. Visual hallucinations are not typically associated with cerebellar dysfunction, while muscle weakness and difficulty speaking may arise from other areas of the nervous system. Question 12. A 25-year-old patient is diagnosed with complex regional pain syndrome, CRPS, after a foot injury. Which intervention should the nurse prioritize for managing CRPS? A. Immobilize the affected limb. B. Administer opioid pain medication. C. Perform passive range of motion exercises. D. Apply cold compresses to the affected area. Answer. C. Perform passive range of motion exercises. Rationale. Complex regional pain syndrome, CRPS, is characterized by intense, chronic pain and autonomic dysfunction following an injury. Passive range of motion exercises help prevent joint stiffness, muscle atrophy, and contractures. Immobilization can worsen symptoms, and opioid pain medication may be used but is not the primary intervention. Cold compresses are not recommended for CRPS due to their potential to exacerbate symptoms. Question 13. A patient is admitted with suspected myasthenic crisis. Which assessment finding indicates the need for immediate intervention? A. Increased muscle strength. B. Respiratory distress. C. Decreased heart rate. D. Elevated blood pressure. Answer. B. Respiratory distress. Rationale. Myasthenic crisis is a life-threatening condition characterized by severe muscle weakness, including respiratory muscles. Respiratory distress suggests impending respiratory failure, making this finding a priority for immediate intervention to ensure adequate oxygenation and ventilation. Increased muscle strength, decreased heart rate, and elevated blood pressure are not typical indicators of myasthenic crisis. Question 14. A 35-year-old patient is diagnosed with Bell's palsy. Which nursing action is appropriate for managing this condition? A. Applying cold compresses to the affected side of the face. B. Teaching facial exercises to improve muscle strength. C. Administering corticosteroids as prescribed. D. Performing active range of motion exercises. Answer. C. Administering corticosteroids as prescribed. Rationale. Bell's palsy is characterized by sudden, unilateral facial paralysis caused by inflammation of the facial nerve. Corticosteroids are the mainstay of treatment to reduce inflammation and promote nerve recovery. Applying cold compresses, teaching facial exercises, and performing active range of motion exercises may not be effective or appropriate interventions for Bell's palsy. Question 15. A 40-year-old patient is admitted with suspected autonomic dysreflexia. Which intervention is a priority for managing this condition? A. Elevating the head of the bed. B. Administering antihypertensive medication. C. Providing a warm bath. D. Emptying the bladder through catheterization. Answer: D. Emptying the bladder through catheterization. Rationale: autonomic dysreflexia is a potentially life-threatening condition that occurs in patients with spinal cord injuries above the T6 level. It is characterized by a sudden and dangerous increase in blood pressure triggered by a noxious stimulus, often due to bladder distension or bowel impaction. Emptying the bladder through catheterization is a priority intervention to relieve the triggering stimulus and prevent severe hypertensive crisis. The other options may not address the underlying cause of autonomic dysreflexia. Question 16. A 30-year-old patient is admitted with suspected Guillain-Barré syndrome. Which assessment finding should the nurse prioritize when monitoring for complications? A. Decreased deep tendon reflexes. B. Hypertension. C. Increased body temperature. D. Bradycardia. Answer: C. Increased body temperature. Rationale: Guillain-Barré syndrome, GBS, is an autoimmune disorder that can lead to autonomic dysfunction. An elevated body temperature is indicative of autonomic instability and should be closely monitored, as it may signal the development of autonomic dysregulation and the risk of cardiovascular complications. While the other options are relevant to GBS, an increased body temperature is a more urgent and concerning sign. Question 17. A 55-year-old patient with Parkinson's disease is prescribed levodopa-carbidopa, Sinemet, for symptom management. The nurse teaches the patient about potential adverse effects. Which statement by the patient indicates an understanding of the teaching? A. I may experience muscle twitching and spasms. B. I need to avoid foods high in protein. C. I should take this medication on an empty stomach. D. I will monitor my blood pressure regularly. Answer: B. I need to avoid foods high in protein. Rationale: levodopa-carbidopa is used to manage the symptoms of Parkinson's disease. However, it competes with dietary protein for absorption, which can lead to decreased effectiveness. Patients are advised to avoid foods high in protein close to their medication doses to ensure optimal absorption. The other options are not accurate regarding the management of levodopa-carbidopa therapy. Question 18. A 22-year-old patient is admitted with a spinal cord injury at the T5 level. The patient experiences flaccid paralysis and loss of sensation below the level of injury. What complication should the nurse be vigilant for in the initial hours after the injury? A. Autonomic dysreflexia. B. Spinal shock. C. Cerebral edema. D. Seizures. Answer: B. Spinal shock. Rationale: spinal shock is a temporary state of physiological reflex depression that occurs immediately after a spinal cord injury. It can cause flaccid paralysis and loss of sensation below the level of injury. Autonomic dysreflexia, while a concern in spinal cord injury, typically emerges later and is characterized by a dangerous hypertensive crisis. Cerebral edema and seizures are not typically associated with spinal cord injuries. Question 19. A 65-year-old patient is diagnosed with a primary brain tumor. The nurse observes personality changes, irritability, and impaired judgment. Which area of the brain is likely affected by the tumor? A. Frontal lobe. B. Occipital lobe. C. Temporal lobe. D. Parietal lobe. Answer: A. Frontal lobe. Rationale: personality changes, irritability, and impaired judgment are often associated with dysfunction of the frontal lobe. This area of the brain is responsible for higher cognitive functions, decision-making, and personality traits. The other lobes of the brain are responsible for different functions, such as vision, occipital, auditory processing, temporal, and sensory integration, parietal. Question 20. A 45-year-old patient is admitted with suspected bacterial meningitis. The nurse performs a neurological assessment and notes a positive Brudzinski sign. What does this assessment finding indicate? A. Hyperactive deep tendon reflexes. B. Involuntary muscle contractions. C. Pain with passive neck flexion. D. Absence of pain sensation. Answer. C. Pain with passive neck flexion. Rationale. A positive Brudzinski sign is a physical examination finding seen in patients with meningitis. It is characterized by pain and involuntary hip and knee flexion in response to passive neck flexion. This indicates meningeal irritation and inflammation in the spinal cord and meninges. Hyperactive deep tendon reflexes, involuntary muscle contractions, and absence of pain sensation are not directly related to a positive Brudzinski sign. Question 21. A 62-year-old patient is admitted with a suspected ischemic stroke. The nurse notes that the patient's left arm is weaker than the right arm, and the left corner of the mouth droops. The patient is unable to raise the eyebrows symmetrically. Which artery is most likely involved in this stroke? A. Anterior cerebral artery. B. Middle cerebral artery. C. Posterior cerebral artery. D. Basilar artery. Answer. B. Middle cerebral artery. Rationale. The presentation of weakness on one side of the body, drooping of the mouth, and inability to raise the eyebrows symmetrically is consistent with a stroke involving the middle cerebral artery. This artery supplies blood to a large portion of the cerebral hemispheres, including the motor and sensory areas for the face and upper extremities. Question 22. A 28-year-old patient with a history of epilepsy is receiving phenytoin, Dilantin. The nurse reviews the patient's laboratory results and notes a serum phenytoin level of 30 micrograms per milliliter. What action should the nurse take? A. Administer an additional dose of phenytoin. B. Withhold the next dose of phenytoin. C. Monitor for signs of phenytoin toxicity. D. Discontinue phenytoin and initiate valproic acid. Answer. C. Monitor for signs of phenytoin toxicity. Rationale. A serum phenytoin level of 30 micrograms per ml is above the therapeutic range, 10 to 20 micrograms per ml, and may indicate phenytoin toxicity. The nurse should closely monitor the patient for signs of toxicity, which can include nystagmus, ataxia, slurred speech, and cognitive changes. Administering an additional dose, withholding the medication, or discontinuing and initiating another antiepileptic drug is not appropriate without further assessment and healthcare provider guidance. Question 23. A 50-year-old patient with multiple sclerosis, MS, is experiencing spasticity and muscle spasms. The nurse anticipates the healthcare provider may prescribe which medication to manage these symptoms. A. Ibuprofen. B. Dantrolene. C. Metoclopramide. D. Phenytoin. Answer. B. Dantrolene. Rationale. Dantrolene is a muscle relaxant that acts directly on skeletal muscle to relieve spasticity and muscle spasms. It is commonly used to manage these symptoms in conditions like multiple sclerosis. Ibuprofen is a non-steroidal anti-inflammatory drug and would not specifically target spasticity. Metoclopramide is used for gastrointestinal motility, and phenytoin is an antiepileptic medication. Question 24. A 35-year-old patient is diagnosed with trigeminal neuralgia. The nurse provides education about the condition and its management. What information is important to include? A. Trigeminal neuralgia is caused by muscle weakness in the face. B. Treatment may involve surgery to remove the affected nerve. C. Avoiding all facial expressions can help prevent pain episodes. D. Chewing gum and talking excessively can alleviate symptoms. Answer. B. Treatment may involve surgery to remove the affected nerve. Rationale. Trigeminal neuralgia is a condition characterized by sudden, severe facial pain caused by irritation of the trigeminal nerve. Treatment options include medications, such as anticonvulsants, and for severe cases, surgical interventions like microvascular decompression or rhizotomy to alleviate pressure on the affected nerve. The other options do not accurately reflect the condition or its management. Question 25. A 70-year-old patient is admitted with delirium due to a urinary tract infection. The nurse notes restlessness, confusion, and fluctuating levels of consciousness. Which nursing intervention is a priority for managing delirium in this patient? A. Administering antipsychotic medication. B. Restraining the patient to prevent injury. C. Maintaining a quiet and well-lit environment. D. Encouraging physical activity throughout the day. Answer. C. Maintaining a quiet and well-lit environment. Rationale. A quiet and well-lit environment can help reduce sensory overload and agitation, which are common in patients with delirium. Restraints are generally not recommended and should only be used as a last resort for safety. Administering antipsychotic medication may be considered in certain cases, but environmental interventions are a priority. Encouraging physical activity throughout the day may be beneficial, but it is not the priority intervention for managing delirium.